Is it showing that it's recording at your screen, Murtala?
Let me
The
check.
transcript, yeah,
Yes.
showing. Okay. So I will open the 3 minutes. If when
Yes.
you reach down, just tell me so I can scroll it up.
Okay.
Okay.
Yeah, I'm
Yeah.
ready.
Yeah.
Right. So can you scroll it down for me, please?
Okay.
Can you scroll it down, please?
Yeah, this is the last.
Okay, this is the last. Okay. Thank you. Can you scroll it up, please? Just want to have
Yeah,
a
sure,
quick
sure, yeah.
rash.
Sure.
Yes. Salim, I'm terribly
Yeah.
sorry.
Yeah,
Can
fine.
you pause it?
Mm.
I just want to ask my kids so that
Yeah, sure, no problem. Yeah.
because
I will pause it. No problem.
sorry,
Yeah,
I'm
is it to
terribly
pause the
sorry.
timing or the recording? No, it's fine.
The
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 timing or
timing
the
only.
yeah, sure, no problem.
Thank you.
While waiting, anyone have any question in any topic, doctors? I don't mind. Just write it down and then we'll address it after the teaching. Or all are happy. The doctors that have exam next week. Any issues, any question, anything not clear you want to discuss, doctors? Oral happy? That's good. Yeah, that's fine.
Not really, Salim. Can't control the nerve.
No, you need to
Getting
control the
very
nerve. No, you need to control the nerve, okay? Because first, what you can do more, okay? If you are studying, doing, mocks with your colleague, asking your supervisor to see you and address, and gain from his experience, I don't think you need to worry because the end result is not in your hand again. I'm saying the end result, it's your destiny. It's written, and what's written is written. So all what you need is to enjoy the learning. Okay, I know, money cost is high, a lot of burden at the family. Okay, all of them are waiting for you to finish. You want to finish so you can finish your CT and work as independent GP. But again, it's not the end of life. Even if you didn't pass, it's not, is not end of life exam. Okay, you have five trials. That's very good. They can give you extension. Okay, so there is a lot of facilities to help you, and then even if you fail, then there is additional support for most of the dinners. So it's not an issue. This is one. The other thing, you need to think positively. So positive vibes will bring goods, will not give negatives. Okay, so just consider it as learning experience and enjoy the learning. This is the most important bit. Okay, enjoy the learning and try not to learn for the exam, but learn for two things. First, learn for the benefit of the patient. Okay, and then for the benefit of yourself to be better doctor. Okay. And the other thing, for the benefit because, well, who save a life, it seems that like he saved all other lives. So it's big indeed, big rewardings from God. Okay, that every information they use it to decrease the suffering of any of your patient. I think the rewards is countless. So just make these are your goals, okay? Not life, not pass or fail. Okay, yeah, pass or fail is something you for sure important, but again, failure is just one step for success. And who knows, maybe if you fail, you will become better, better doctor. It doesn't mean that, if you pass from the first time, you are brilliant, and if you pass from the second time, you are not that brilliant doctors. No, it's not like that.
I'm back,
Okay.
Salim.
You are back. Okay, good, good. So is that fine? Always
Yes,
think
thank
in
you.
this, yeah, always, doctor, think in this way, okay? Is not death or life, okay? And enjoy the learning, and keep your aim as to benefit the patient, and to decrease the suffering of the patient and the others. And just leave it because it's destiny. No one can change his destiny. Okay, but that doesn't mean that you don't do your job. Do your part. Okay, do your part, and what is
Sure.
left is not in your hands. Yeah, yeah. Don't go and watch Netflix and play video games all the day and then say, okay, it's not in my hand. Do your part, and then what is left, is on God's hands. Okay.
Inshallah.
So, inshallah, shall we? Um, Murtaza,
Yes,
shall we?
yeah, yes.
Do you want me to restart the
No,
timer,
no,
or it's fine?
I'm not, I'm fine. Go ahead,
Okay,
please.
sure, sure. Yeah. Up or down, or you are fine
Just,
with, or
just
you
down.
want you want it bigger, the photo?
That's fine. No, the photo
That's
is
fine.
fine.
You want
Yeah.
to go down? You want it down a little
Yes,
bit?
please.
Sure.
Yes, please. Yeah, that's it. Thank you. I'm ready, Salim.
No, my rule is the 3 minutes is
Okay.
yours. So
Okay.
use them. Okay. There is three benefit of the 3 minutes. Predict what is coming,
Hmm.
think deeper, and do breathing exercises. Okay. And then after doing breathing exercises, neutralize your thinking, because what you predict is not fixed. Okay. You may predict something, but then the patient have another agenda. So yeah, so be prepared in the 3 minutes, but make your thinking neutralize and don't be fixed thinking. And then
Okay.
come over the nerve in the 3 minutes. If you feel that there is a lot, 3 minutes is a lot of time and you have time, then do breathing exercise, do meditation, pray for God, do anything that can, calm your noradrenaline down a little bit. Okay.
If you could please scroll it down, I just want to have those medication
Yes,
in front of me.
sure.
I know about the photo.
Yeah, sure.
Thank you.
Mhm. Yeah, so I will start directly the 12 minute. I will not discuss regarding,
Yes.
the case
Yes.
will discuss after, okay?
Yeah. Thank you.
Yeah, no problem. Yeah, go ahead.
Hi. Hi. Good evening. This is Dr. Murtaza from the surgery. Am I speaking with Jessica Brown?
Yeah, doctor, thank you for calling.
How would you like me to address you?
Well, as you like, I think Jessica is fine, doctor.
Hi, Jessica. Jessica, I have reviewed your notes and it says that you have got a rash. Can you tell me in your own words just to get an idea what's been going on?
Yeah, doctor, to be honest, it's not rash. It's my eczema, doctor. It's just becoming weird little bit. Usually my eczema will be controlled with, with the moisturizer, and so I am buying some hydrocort from, the over the counter, but this time it seems to be different. So I'm not sure, so I think it's quick one. So if you can give me stronger, maybe ointment or something that will make the eczema go, because I have a flight to catch after 4 hours. So
Right. You mentioned you have got a flight to get.
yeah,
Where?
yeah. I'm
Where?
traveling to Spain. Yeah, I was planning for this holiday long time ago. I'm
Okay.
missing the sea and the sun, so I'm going to Spain,
Okay.
So yeah, and then I thought, oh, this my eczema, when I expose it to the sun there, it will become worse. So I said,
Mm-hmm.
better to call you to give me some, some bitter cream to come over this, the rash.
Mm, okay. And I can see on your record, it does show that you have got eczema
Hmm.
and you are on some zero base cream.
Hmm.
Is
Hmm.
that correct?
Yes, yes.
And y- do you think that this rash is different than your eczema?
Yeah, doctor, well, which is making me weird little bit. At first, it's first time that is not responding rapidly. Usually my eczema is not that bad.
Mm-hmm.
And also, before the rash, I felt some pain in my face. And to
Mm-hmm.
be honest, it's like burning, like I have
Mm-hmm.
a burn in my face. And then the
Mm-hmm.
eczema started. I said, oh, my skin
Mm-hmm.
is playing up or what?
Mm-hmm. Right, right. And do you have rash anywhere else on the body,
No, no,
Jessica?
no,
No.
no.
Okay, okay. And apart from you mentioned a strong ointment, is there anything else you were hoping we might be doing today?
No, no, just an ointment, doctor.
Right, right.
And
And have
maybe also painkiller, doctor, because really it's, I feel burn. First time my
mhm,
eczema to be burned. I mean, maybe it's I had some like something like that when the eczema is infected, it's making that, but I can't see any weeping. I'm not sure it's infected or not. I'm not sure to be honest. It's weird little bit, doctor.
okay. And how long, it took for the rash to appear? You said that you had some burning and pain initially,
Yeah. Well, I
followed
think
by this rash.
I think 2 days.
2 days. And how long have you had this? You mentioned this eczema. How long have you had this rash?
Yeah, it appears from 2 days also. So all like
Okay.
4 days now. Yeah, this is the third day.
Okay. And when you say it's playing up, just wanted to know your thoughts. Sorry, I'm just repeating myself and
No, that's fine.
pressing you. Do you think that this is eczema?
Yeah, yeah. Well, I don't. Well, is it something else? I don't know. But I thought it's an eczema.
Right, right. We will talk about it, Jessica. Just a few specific questions. Have you
Mhm.
got any problem in your vision?
Uh, no, but it's my
Any
eyes
dim?
watery. My eyes
Mhm.
water a little bit, but no, but I'm
Mhm.
seeing fine.
Right, because your left eye is slightly closed than your right eye, so I can't see the inside of eye. Is there any redness in
No,
the
no, it's
eye?
just I think because the skin is inflamed, just
Hmm.
that's why my eyes closed. I think so.
Hmm.
No, but
Hmm.
but my eyesight is fine. I can see fine, doctor.
Right, right. Any fever with it?
Fever? No,
Yes. Any headaches?
no, no headache, but I feel generally tired, to be honest, doctor. But I think because I'm trying to think
Hmm.
what to make rationale of my symptoms. So I think because I'm preparing, the luggage and this and preparing for the beach. So I think that's why
Hmm.
I'm feeling tired.
Hmm. And anyone else in the home has got any rashes?
No, no.
No. And you have this rash, you mentioned that, almost for the last 2 to 3 days. Is it affecting your day-to-day life? Especially rash on the face can affect people confidence, people mental health.
No, it's just I'm just worried that it may increase when I go to to and exposed to the sun. And then
Mm-hmm,
I will feel embarrassed. The people will say, "Oh, see how this,
mm-hmm,
this
mm-hmm,
lesion in the skin or something." So I'm
mm-hmm.
just trying to avoid that. I may feel embarrassed.
Okay, yeah, I can't imagine that must be quite tough. Who else is it at home, Jessica? Are you on your own or?
No, I have a friend living with me.
Mm-hmm.
Yeah, I have a friend.
Okay, right. And I mean, one of the condition going through my mind is herpes zoster, which is a viral infection which can present in this way. And just wanted to check whether you have had a vaccination for shingles.
Oh, shingles. Okay. Oh, yeah, I know shingles, but I don't know this herpes zoster.
Mm-hmm.
Well, no, they didn't invite me yet. Yeah, they should have invited me, but no, no, still I didn't get the invitation yet.
Right, right. And I can see on your record you are having diabetes and you are on some medication as well. Are you taking your medication as prescribed?
Yeah, doctor, I'm taking them.
Okay, excellent. And what about your diabetes control? I can't see any test on your record. When was the last time you have had your HbA1c, which is a
I think,
diabetes
yeah,
test?
yeah, I go to, yeah, I think it's, I'm due maybe in two or
Hmm.
3 months. Yeah,
Hmm.
the nurse should
Hmm.
invite me to come for
Hmm.
that.
Right, right. Now, Jessica, as I mentioned earlier, uh, I think one of the possibility is it looks like you have got shingles and it's not eczema.
Oh, really?
Yeah, the reason I'm saying you have had some pain and then followed by this rash, and you you did mention there was a gap as well. So between the rash appearance and pain, and this this rash, and when I say rash, shingle is really common in people who are having diabetes.
Hmm. Okay, okay, doctor. So what we should do? Well, that makes sense. That's why I had pain, maybe. Oh, okay.
Yeah.
Okay, doctor, what we should do?
Now, I mean, normally, we prescribe, I mean, this is a treatable condition. Normally, we prescribe antiviral tablets, acyclovir, which is a 800 milligram tablet uh, taken times a day for 7 days. But the challenge here is this rash is around your eye as well. And one of the side effect of this rash is it can affect vision and the layer of the eye.
Oh, really?
Yeah.
Oh, uh,
And
well, this came as a surprise for me, doctor. Oh,
I'm
so,
I'm
so
just
what?
wondering. Yeah,
Huh?
go ahead.
No, it's fine, doctor. You tell me now. Yeah. So what I should do?
So, I mean, it will be really useful that, we contact the eye team now and to send you to the to the hospital so that they review you.
Now?
Yeah,
Oh,
I know you did mention that, you have got travel plans and you want to go there, but I think this will be really important that, you should be seen by them because it can cause permanent blindness.
oh my God! I can become blind. So what about the flight, doctor? I have flight after, after 3 hours now.
Yeah, yeah, I can see this is a very difficult situation, but the way forward would be you need to be seen by the eye people now. And I don't think so that creams would help. And this I mean they will give you these antiviral tablet as well, but they need to see you today. And when
And
I say the eye people need to see you today, they will examine your eye, they will check your vision. You did mention that you don't have any dimness of vision, but they may give you steroid tablets as well.
mm-hmm, mm-hmm.
Do you think you
So,
can rearrange your flight? Is that a possibility? I can see you are completely shocked.
well, I'm not sure. I can contact the travel agency, but
Hmm.
usually
Hmm.
they will cancel the things, and they will not give me my money. That's because it's in the
Hmm.
same day. If I knew that 3 4 days ago, they might
Hmm.
return.
Hmm.
But so if I travel, I cannot take the medication and travel, and then we come back. They can review my eye, or what you think, doctor?
I'm afraid, Jessica, that wouldn't be possible. And the eye appointment is really important.
Mm, mm.
S-
Okay, that's fine, doctor. No
How, how,
problem.
how would you go to the hospital? I mean, I wouldn't advise that you should drive. Is there anyone, you did mention that, you have got a colleague with you. Can that person take you to the hospital?
Yeah, she can take me, but is that that can infect her, or what? Is that something can infect her?
Now that's a very good question, uh, Jessica. I mean, as long as you are keeping distance from your colleague, and that person is not touching this rash, it wouldn't be transmitted to that person because it can only get transmitted through contact.
Okay, okay, doctor. Yeah, no problem. We will go. So you will contact them now, the eye
I will
doctor?
ring the I team right now and they will be waiting for you.
Okay,
My time is
good.
finished,
Yeah, that's
and
fine.
I need to see you again in two
Yeah,
weeks
that
time.
sure, sure, sure. After the eye doctors, yeah, see you. Yeah. So how do you think?
Yeah, so I mean the uh, issue was clear from the picture that this is likely shingles, and during the data gathering, uh, I mean, you were completely surprised. So I just wanted to flow with your motion rather than, putting my other thoughts, like, asking you that whether that person is pregnant or have you been in contact. Is there any
Yeah,
pregnant lady around? That was the top most important
sure,
question playing on my
sure,
mind,
sure,
right in the
sure.
middle.
And
I mean,
immunocompromised as well. Yeah, yeah, you're completely right. Yeah, yeah.
yeah,
But
and
but mhm.
some of the things like I deliberately skipped, asking smoking, asking
Oh,
alcohol.
there is no
Uh,
time. Yeah, yeah, you are right. If you ask
uh,
about this, then it will be, it will kill the case. That's fine. It's acceptable to skip it because it will
and
not make any difference in the management. Yeah,
my battle plan was like, to I have written it down like acyclovir, amitriptyline, steroids, but
yeah.
ophthalmology referral
Which
on
is
the
the
top.
yeah. Sure, sure. It's yeah. You are right. Absolutely right. It's just maybe if you had time, maybe you can explain later on about the post-herpetic neuralgia and the complication. You did say that your sight is in danger and you can lose your sight, and that was sufficient, to be honest, to cover in 12 minutes. Yeah, that's good. Would you make anything different?
Mm, I think maybe to maybe minimize repetition. I'm not sure what did I repeat. I did when you give me volunteered your eyes that you think eczema is playing up and strong ionment, flight, painkiller. Uh, because of the time constraint, I mean, my exam is near. Usually, if a patient would volunteer the expectations, I don't ask them again because of the time constraints. But I know some people don't like it. They say that, retreat it
Yeah,
again,
yeah,
that
yeah,
you
yeah.
said that.
Well, yeah, you acknowledge it and then add on it. It won't take a lot of time. It's just to make the examiner feel that you did an active listening. Okay. Or you can just put it in the management. I did hear you saying, okay, that you want a cream, in the management, but I think the cream is not an effective idea because you have this. So herpes zoster ophthalmicus, which is shingle affecting your eye, and the best treatment for it is we need to start the antiviral, the cyclovir, rapidly for you and referring you to the eye specialists today. So you can either acknowledge it before
Mm,
starting the management and
mm,
re-ask it, or you can just, if you feel that there's constriction of time and you have different plan, so just put it in the plan. I hear you saying that you want this, but I don't think it is, or yes, it's a great idea. I will prescribe it for you. So you can do both techniques, either repeat
mm,
it up, or if you feel
mm,
constricted, just put it in the management and you will save it
mm.
like that. and then they will, you will get the mark of the active listening. Because,
mhm, mhm,
otherwise, if
mhm,
I'm hearing you, I don't know, did you hear it or not? How can I know? Maybe you can just skip it, isn't it? So I still
mhm,
don't know if you hear it and you
mhm,
acknowledge it and you will use it in your plan or not, except if
mhm,
you mention it,
mhm,
isn't it? So this is the only way to,
mhm,
to show, to demonstrate that you
mhm,
are active listening. Okay.
mhm, mhm. Okay, okay.
Hmm?
Thank you.
Yeah, and I like, yeah, you ask about systemic symptoms. Maybe maybe you can maybe add neck pain or something, okay, because you need also with the eye, especially, from the embryological point of view, the eye is part of the brain, okay?
Mhm,
So
mhm,
any infection in the eye, it can
mhm,
be transmitted easily to the brain, and this is the
mhm,
and this is one of the drawbacks of the herpes zoster ophthalmicus. Okay, so not
mhm,
all herpes zoster ophthalmicus, by the way, is dangerous, but the problem is if the herpes zoster of ophthalmicus is
mhm,
affecting the nasociliary branch of the ophthalmic nerve. So if
mhm.
in this picture, and I will
Yeah.
explain why, and I will show you in the photos in the PowerPoint. If in this picture you can see that the ala of the nose and the tip of the nose is affected with the rash.
Mhm,
Okay, so this means that the nasociliary branch of the ophthalmic nerve is affected. And then the nasociliary branch is supplying the ciliary muscle. So it's supplying the uveal tract,
mhm,
and through this connection the virus can spread to the inside of the eye, and and then can cause either endophthalmitis, or can cause retinitis or optic neuritis, or even keratitis, and then that will affect the eye, and then from the eye can spread to the brain, causing meningitis, meningoencephalitis, and these are the main dangerous, and that's why it's an emergency, need to be seen, because it can either affect the sight of the eye or can affect the brain itself. And the
mhm,
other way that it can affect the eye, because it decreases the corneal reflex. Okay, so if it's not affecting the nasociliary branch, it can affect the corneal reflex, and then it will affect the protection of the eye, and the spreading of the film, of the
mhm,
tears film of the eye, and this can cause dry eye and then keratitis. And these patients, usually you would like to make eye patching and give them a lot of lubricants, as treatment with the cyclovir as well. Okay,
mhm,
so
mhm,
these are the dangers of the, to be honest, of the herpes zoster ophthalmicus, and why it's an emergency.
mhm,
Um, Otherwise, if you have herpes zoster in the chest or in the limb, or affecting single or dermatomes, you are not referring the patient. But why specifically the eye? Because of this link.
mhm,
Okay. The other thing, yeah, I would like to hear about at least neck pain. Do you have any neck pain, or or
mhm,
are you
mhm,
muddled, just to make sure
mhm.
that she doesn't have neurological symptoms, central neurological symptoms. Um,
Is it because of encephalitis you are saying?
yeah.
Okay.
Because encephalitis means not only ophthalmic, so you most probably will not refer her to the eye doctor. Then you need to refer her to the emergency, because encephalitis need IV cyclovir, and then
Mhm,
need
mhm,
isolation. So
mhm,
when the hospital have herpes zoster encephalitis, it's something that is not taking unseriously. So it's a serious disease, and
mhm,
I think it should be reported as well. And
mhm,
most probably they will be admitted in the ITU,
mhm,
starting IV cyclovir for them, and
mhm,
complete isolation measure. Okay.
mhm, mhm,
Um, in the management, I like, yeah, you did explain what is, yeah, you did say herpes zoster, and then you
mhm,
explain it by shingles, because most of the patient will not know herpes zoster, but they will know
mhm,
shingles.
mhm, mhm,
And you did address the patient holistically. So you did ask about diabetes, and maybe you will tell her later on we need to do also blood tests to check your sugar, because if your immunity is low, that will make the things clear. And you did touch base on that.
mhm, mhm,
Um, I would you mentioned the vaccine, but then I would promote the vaccine. They're okay. Hopefully
Mhm,
everything will pass fine. But then
mhm,
I hope to see you later, and which I think that time didn't didn't save you for that. I need to
mhm,
see you again because we need to
mhm,
see to give you the vaccine, which can
mhm,
decrease the frequency and
mhm,
decrease the complication of having
mhm,
herpes zoster again.
mhm,
Um, when you prescribe a medication, I would like to hear the dose, and you did, but
mhm,
then possible side effects and duration.
mhm, mhm, mhm.
So you know the duration.
Yeah, I think it's 7 days, isn't
Yeah,
it?
7 to 10 days, and the BNF is 7 days, but other textbooks are saying 7 to 10 days. What is
Okay.
possible side effect? Because it's
So,
important.
yeah, so oral is like GI
Yeah,
upsets, everybody would say.
yeah, yeah.
And
Well,
any specific
mhm.
acyclovir, how? Okay, I'm not able to recall.
Hepatitis, no, no, hepatitis
Okay,
is important. Okay,
hepatitis.
yeah, yeah, it can affect the liver function. Okay, however, the benefit from the tablet at your case is much more than the side effect. So I would strongly recommending to start it as soon as possible. Okay,
Mm-hmm.
this is how you can address it.
Okay.
Um, yeah, so yeah, to be honest, yeah, also I say, yeah, it's a safe consultation. You know your stuff, and I'm happy with it. Yeah. But just if you can promote because it's important, promotion of the vaccination. I think one of the things that it's important, and managing the patient holistically. And if you have time, saying about post-herpetic neuralgia, and you may have still pain, and then if you still have pain, you can come and we can
Mm.
address that. What you would prescribe for post-herpetic neuralgia?
So amitriptyline, 10
Okay, yeah,
milligram, one
yeah, yeah,
daily.
yeah.
This
So,
patient is on mirtazapine. So, 2, 1. Yeah, but I think.
you can add it very low dose. You can, yeah,
Mm,
or pregabalin, any of the neurotropic
mm,
pain
mm,
medication can
mm,
be fine, but for sure you will not start with it. Okay, so you will
mm,
use the pain leather again, paracetamol, cocodamol, non-steroidal. Like, although she is a little bit in the elderly side of it, and
mm,
she having
mm,
diabetes, so be cautious about the kidney. But still,
mm,
you can take it a stepwise approach, and then,
mm,
if not helpful, then you can use
mm,
the neurotropic drugs and or the gabapentins.
mm,
But there is one medication, unfortunately, I'm not sure why the people are not using it that much. Perhaps because there's shortage of supply, which can even be used in chronic osteoarthritis pain, or
capsaicin.
neurocapsaicin, yeah, capsaicin. So
Eh, eh, mm,
it can be used for chronic pains. I know that there is delay onset of action because it depends on the desensitization of the
mm,
nerve endings,
mhm,
and need at least 6 weeks to start to work. And the problem is you cannot buy it on the NHS because there is always short of supply. But
mhm,
surprisingly, you can buy it from
mhm,
eBay. So my patient, I'm telling them, if you can buy it from eBay, buy it from
mhm,
eBay, and they are getting it from eBay
mhm,
with some conservation because we don't
mm,
know,
mm,
the ingredient,
mm,
and
mm,
if it's fake or
mm,
not, but it's
mhm,
there. So
mm,
capsaicin is one of the things that the patient
mhm,
may use it, okay, and
mhm,
and consider it in such patients, especially if they are high risk or you are worried that she may become addicted to the pregabalin or the
mm,
amitriptyline or the other drugs. Then,
mhm,
yeah, consider the capsaicin cream, please.
mhm.
Yeah,
And one important question,
sure.
like this lady now has had shingles. Now
Uh-huh.
she will develop antibodies invariably after this
Mhm.
infection. Now I'm a bit doubtful.
When
Do,
you will give her the vaccine, you mean?
because is there any benefit of giving vaccination? Because she will develop antibodies
Well,
anyways.
well,
Ne-
yeah, it's valid question, but then, but then why not? Why not to give her the vaccine, for sure not after the infection directly, okay? Say after 3, 4 months, you are giving it because if you compare it to the COVID, okay, if you get COVID, are you taking the vaccine or not?
Yeah,
Yeah.
yeah. In COVID,
You are
we do.
taking it. You do it after 2 months post infection. They are giving it because by 2 months your memory cell, the antibodies from the memory cell will start to decline. So giving it once more, okay,
Mm,
will reinforce the memory cell, okay, and reinforce the plasma cell
mm,
to produce more memory cell, and
mm,
that will make your immunity more, will fight any reactivation of the virus, okay?
mhm,
So because
mhm,
the problem with it is reactivation. So the virus is still there, still living in your body. There is no
mhm,
cure, but you can
mhm,
control. Yeah. So I think, yeah, you can do that after 2 months or something. You can re-give him again, and then keeping in mind that the vaccine that is available in UK is recombinant vaccine. That means that they are part of the virus. Okay. So the risk of having
mm,
shingle-like symptoms is less likely to happen. Okay.
mhm,
Yeah.
mhm,
Although there is some reported cases that they got some activation or shingle-like symptoms after Shingrix, which is the vaccine in the UK, but it's very
mhm,
minimal to happen. Okay,
mhm,
so
mhm,
yeah, you still need to, and the vaccine is 2 doses, so she will have 1 dose, and then after a few weeks she will get the other dose, to be fully vaccinated. So yeah, it's proper to emphasize the importance of the vaccine. Yeah.
okay, okay, thank you.
And this is for the referral of the eye, but what about then if it's body, if it's affecting any part of the body? So how you would start the treatment?
So if it is not involving the eye, I will just say use acyclovir 800 milligram 5 times a day for 7 days. And
Okay.
for pain, I will say use paracetamol
Hmm.
and can use, I mean, she's diabetic. I mean, ibuprofen, yeah, can use, but this is a neuropathic pain. So for that, usually these medication may not work.
May not
So
work. Yeah, but you need to try it first.
yeah.
Okay, so you need to try it first. The issue is still there is some cases that you need to refer. So if you have immunocompromised patient, he need to be referred. Okay. If the patient have
Mm,
recurrent activation
mm, mm,
of the virus and you don't know
mm,
what is the cause, he needs to be referred. And if it's
mm,
first symptom, the first presentation, also you need to at least to check his sugar level because that can be presentation of diabetes. This patient is already diabetic, but if the
mm,
patient is coming, and feel
mm,
that he is healthy, and you need to
mm,
know why his immunity is low,
mm,
then at least check
mm,
the thyroid and
mm,
to be honest, there is no specific guidance in that, but you can. This is from the practice. You check his
mm,
immune status, you
mm,
check his, sugar and thyroid.
mm,
Okay, and if
mhm,
it's recurrent, you need to check HIV. So also, if
mhm,
it's recurrent, that's one of the things. And even if you didn't find any
mhm,
reason for the reactivation, and you may need to refer him just to
mhm,
know why he have recurrent infection of the virus.
mm,
One of the other things it's present in the I think Dr. Emily book is if the patient is pregnant, as you said, so this needs to review it. If
mm,
the exposure to pregnancy or exposure to immunocompromised,
mm,
how we should deal. And I think I will try to present it in one other week, to have
mm,
cases with pregnancy
mm,
rash or something.
mm,
Also, neonatal exposure. Okay, if
mm,
patient is neonate, is just born and he doesn't have the antibodies, so how
mm,
to proceed for it. This one also of potential,
mm.
cases can appear. Um, I think these are most of the things that I want to talk about. It's
Yeah.
just in the systemic because you mentioned steroids, so there is no sufficient evidence. I know
Mm,
that we used to be honest, I used to prescribe it for the
mm,
pain, especially,
mm,
and the
mm,
patient reported that there's, there are
mm,
benefit. Well, I thought for sure there will be some benefit because it will suppress the
mm,
inflammation. But
mm,
when I review the science behind it, there is no much strong data behind it. Okay.
mm, mm,
So be cautious not to say
mm,
something that
mm,
you can be
mm,
marked down for it.
mm,
Vitamin D deficiency
mm,
also, some people will prescribe vitamin D, but there
mm,
is no
mm,
sufficient data behind it.
mhm,
If it's more than 3 days, would you prescribe? Well, herpes zoster ophthalmicus, you need to prescribe and you need to refer. But if it's
mm,
body affection, well, yeah, you may, especially if he is more than, or the patient more than 50
mm,
years old. So yeah, you
mm,
may, because the incidence of post-herpetic neuralgia may decrease. Yeah.
mhm,
So it's
mm,
worth, or if there is still activity of the disease. So if still
mm,
you have rashes,
mm,
and the patient have new rash on the
mm,
presentation, and even if the disease started more than 3 days, so
mm,
you need to prescribe the acyclovir, because mean
mm,
that the virus is still active. Avoid
mm,
local treatment. Okay, so because we used to be honest, right, lidocaine, acyclovir locally.
mm,
Okay, cream, like Zovrax cream for the herpes
mm,
simplex of the mouth. So all the data is against that now.
mhm,
um in the hospital where I'm working, they are prescribing for herpes zoster ophthalmicus with the acyclovir tablet. They are gamcyclovir eye drop. But
mm,
again, most of the data against that, because the preservative in the eye drop can, if
mm,
he started to develop keratitis, okay,
mm,
post-herpetic
mm,
herpes zoster
mm,
keratitis, will
mm,
delay the healing of
mm.
the eye. Okay,
And
antibiotic not
mm,
indicated except if there's super added infection.
and what exactly the eye people will do? Just examine, and that's it.
Well, examine. Well, this is the most important thing, because the examination, visual acuity, okay, and then examine the back of the eye, see if there is retinitis. So if there start the
Mm,
retina to be affected, because
mm,
it can cause, necrotizing retinitis. So they
mm,
will examine the back of the eye, and
mm,
usually they will ask the patient to come again after 3 days to re-examine him again. And if they are feeling
mm,
happy with the improvement of the symptoms, they will just
mm,
discharge him. If not, and
mm,
the complication is there, then they will admit him, start him in IV antibiotics, sometimes immunomodulator. It's a bit complicated when it start to affect the back of the eye.
mm,
So yeah, that's why they need to see him, because they will follow him up. Most probably they will not admit him, except if they see, because they can see that even before the inflammation, progress, they can see flares and the floaters in the vitreous of the eye. Okay, with the
mhm,
slit lamp, okay, or
mhm,
even not with the indirect ophthalmoscope. Usually they are using slit lamp or man lamp. There's something called man lamp, hand man lamp, which you can see better resolution if there is flares inside the vitreous and or the aqueous humor. Then they will be able to predict
mhm.
if the uveal tract will be affected or not. So that's why they need to see the patient.
Okay, thank you.
Yeah, yeah, no problem at
Yeah.
all. I will just scroll to see if there is anything I forgot to say. We said about Hutchinson sign. Yeah, the Hutchinson sign is the affection of the ALF. Then will this mean the nasociliary nerve is affected? And here the connection between the nasociliary affection and the endophthalmitis, or the ciliary infection by the virus, because the nasociliary is going to the short ciliary nerve, which is affecting the iris
Mhm,
of the eye.
mhm,
Um, Glaucoma, discharge, uveitis, eye complication. Yeah, so most of the things we did say it. Um, yeah, also we need to refer if the patient have multiple segmental affection, okay? Not only
mhm,
immunocompromised. So some people will have lumbar, thoracic, and lower limb herpes zoster. So this is disseminated infection. He need to be
mhm,
admitted because they can give him immunoglobulin. This is one to control the infection, and then they
mhm,
can give him the acyclovir. So such cases
mhm,
will need immunoglobulin and the immunosuppressed, and the pregnancy also. If she is high risk of transmission of infection, they can give her immunoglobulin to control the virus and then start the acyclovir. Okay.
mhm,
These are the definition of the immunocompromised according to the Green Book. Okay, so HIV, malignancies, and
mhm,
there is some, those qualifications of the prednisolone.
mhm,
If anyone, when they review the recording, they can have a thorough look of it. Okay. Um, what next? We said, this is very good summary of the post-exposure prophylaxis. There's very summarized guidelines. If the people have time to read it, that's fine. If not, we will. I think I will touch base by one case in the post-exposure prophylaxis. We have multiple post-exposure prophylaxis that we may be exposed in the general practice. So HIV post-exposure prophylaxis, needle stick injuries, post-exposure prophylaxis. Okay, and shingles is one also of them. So this worth just knowing, and because it's not that common in the general practice, but every clinic, every surgery should have policy for for the needle stick injuries. So for example, you have a nurse colleague and she was taking blood from one of the patient, and then she stick her self. So what you should do and how you proceed, I think you need to at least to review your local guidance, because it's potential real life scenarios, and perhaps exam. So who knows? So better to know that, have a familiarize yourself with such cases. Um,
mhm,
we ask about herpes zoster. Um, yeah, topical, avoid the topical. And this is the dose of the prophylaxis and the treatment of acyclovir. Post-herpetic neuralgia, we touch base on it, and the pregabalin, neuropathic pain, and topical capsaicin. And be aware that also topical capsaicin can be in chronic osteoarthritis, so you can use it. General advice, symptomatic. Yeah, I think, yeah, these are most of the things. Yeah, we'd already discussed it. Is there any, and the vaccination, be aware about it. Okay, that the eligibility from 60 to 80 years old. Uh, if immunocompromised can be given before the 50 years old.
mhm.
Yeah, so yeah, pregnancy, neonate and post-exposure. Yeah, I think, yeah, this are most of the things that I think you need to know about the herpes zoster. I'm not sure if anyone have any question regarding what we discuss in the herpes zoster, or all of you happy.
Yes, Salim, I have a question.
Yeah,
So
sure.
you have mentioned this antiviral medication. So is it I'm going to prescribe this or
You mean the acyclovir?
yeah,
Yeah, you can prescribe it, but don't delay
okay.
the referral of the patient because
Mm-hmm.
of the prescription. I mean, if it's
Okay.
available in your dispensary, give
Mm-hmm.
it to him. If it's
Okay.
not available, don't tell him, don't go except when we order it. Yeah,
Mm-hmm.
he can take always, either the green prescription and buy it from anywhere, or
Mm-hmm.
when he go to the hospital, most probably
Mm-hmm.
they will prescribe it and he can take it from the hospital dispensary. So
That's what I
yeah,
was thinking because so far we don't know how is the situation going on in the eye. If it is like quite spread and patient need IV, that's why I was thinking like, shall we prescribe
but
or
but then even if he need IV, okay, so one oral tablet that he will take until he go to the hospital, I think can make
okay.
difference in the prognosis, but cannot make harm.
Okay.
So if he take it tab oral, they will not tell, okay, we'll not give him the IV. They will give him the
Mm.
IV still.
Okay. Yeah,
So
sure.
yeah, so yeah, better to prescribe. Is like like sepsis. If patient have sepsis, you will not, and you have antibiotic and he can take it. You will give it to him and refer him, isn't it?
Mm-hmm.
You will not wait until he go to the hospital because it will not. First, it can benefit the patient, it will not harm him. Second thing, you don't know what is the delay time until to be seen there, how many hours or he will be missed in between, or the eye doctor will write only the eye drops or will avoid the oral tablets, and then so better you prescribe it, do your bits, and
Mm-hmm.
then refer at the same time and don't delay. So this is what I do. I prescribe the oral acyclovir and then I call the eye clinic. We have 24-hour on-call eye doctor. You will call them, and most probably, even if it's out of hour, they will take the data of the patient. They will make appointment for him even in the morning to come and see. Okay, if
Mm-hmm.
they don't have, if they cannot see him at night, so most probably you will need to give him
Mm-hmm.
the acyclovir tablet. Don't delay it.
Yeah, and the question you asked, like, is my friend safe to drive me because of the
Yeah, well,
exposure?
because of the exposure. As Murtaza say, most probably if she's covering her face or
Mhm,
covering the area, so that will not make the virus shed. So you are covering the shedding, okay. Although the typical contact is even, is staying in the same room for 15 minutes. So the guidance is saying if the patient is even coming to you in the clinic and, and will stay in the waiting area and he's immunocompromised or having the rash in exposed area, they would prefer to keep him in isolation room. Okay, so the isolation room is the COVID room. So there should be COVID room in each surgery, and they said it's better to be seen there. The issue is already her uh, friend is staying with her at home. Okay, and the rash already appears from 3 4 days, before, or 2 days before. So her patient, so her friend is already exposed.
mhm,
So if she went with her, there's no, I think, a big harm, okay, because she is already exposed. The other
mm,
question, if the driver or someone is not exposed, okay, and was not exposed to the patient, will it be safe to drive the patient or not? This is a question that debatable, to be honest. So again,
mm,
if she cover it, less likely that it will affect him. But then they will be in the car, enclosed area, okay.
mhm.
And again, the secretion most probably in her hand. She will touch the parts of the car. So is it still transmissible? Yeah, it can be. So this will be the question. If not, then you may call the ambulance and let her go with the ambulance. Okay. If her friend have high risk of transmission and is not living with her, because this case is already living with her, so it's already exposed. So
Mhm.
you may tell her, okay, now we need to call the ambulance for you to come and take you.
Okay.
Yeah.
Do we need to ask herpes zoster oticus questions because,
The
like her,
what? The what?
like herpes zoster oticus question, like ear involvement and hearing loss or anything in
You
that
mean
case?
Ramsey Hunt? You mean Ramsey
Yeah,
Hunt?
yeah.
Well, yeah, you may ask it, but the issue is she came with her eye, so most probably there is nothing in the ear, so you can
Oh,
ask her. I mean, yeah, but I feel that the case already, there is a lot to cover. So if you have time, yeah, you ask. Why not? Yeah, if is your ear having pain in your ear, if there's any problem in the hearing, you can ask her if you have time.
okay. Yeah, sure.
Yeah,
Thank you.
yeah, no problem, no problem. Uh, so anyone, I will just close the recording.